This is a demonstration of tracheostomy care. I have performed my standard steps. I have elevated the bed to my working height, and Miss Nightingale's head is elevated. This is Miss Nightingale, by the way. So I will pre-oxygenate her if I have an order for that. That would come from the physician. Then that would mean increasing her liter flow by whatever the physician has ordered for a certain number of minutes, seconds or minutes actually. Or I can have her pre-oxygenate by having her take some deep breaths. Miss Nightingale is not able to do that. I'll check my solutions. I have hydrogen peroxide. It does not have an expiration date on it. And normal saline I will be using. And the expiration, this has not yet expired, and it is normal saline. Palm the label, and now I'm going to open up my Tracheostomy Care kit and put on my sterile gloves. They happen to be on top. Sometimes the drape is on top. And now I'm going to establish my sterile field, and I have a sterile drape, which I will not shake, but I will open. And when I lay this, I will lay it the plastic side down if it works out that way. Not a huge issue if the plastic side is up. And when I lay this, I will lay it coming towards me so that I'm not reaching over it and drop it. Now I have some items in here that will all be sterile. My suggestion is that you lay them right in the middle of your field, because you know an inch around is contaminated. This is the fenestrated drape, which I will use at the end, and this does not need to be sterile when I come to that part of my procedure, so I will lay that to the side. I do have some pads for cleaning, and I'm just going to separate these so that it's easier for me to get to them. Again, towards the center, and my trach tie I will use at the end, and again this just will not need to be sterile, so I will set that to the side. Now I'll pour my solutions, and this, so I'm going to have a non-dominant hand, and I will use my non-dominant hand. I'm going to make this one my non-dominant hand, and I will pour saline into this particular tray. Has two compartments, so I pour saline into both of them. And then my peroxide into just one of them. And I want an estimated half peroxide, half saline. And I'm feeling a little awkward about this, but it works. Now with my non-dominant hand, I'm going to remove the oxygen. And I'm going to remove the drape that is around the trach. And now I'm ready to clean around the trach. Every time I pick something up from this sterile field, I need to pick it up with my sterile hand. So I will pick up this cotton tip applicator, and I'm going to dip it into, it's that wash, rinse, dry. So I'm going to wash it first with the hydrogen peroxide solution. And I'm being very careful not to contaminate this sterile hand. And when I do it this way, I can actually manipulate the trach when I, the trach when I do that. So that's wash, and you can certainly do that more than once. I come back to my sterile field, and I'm going to rinse this time. And this is another way to do this. If you pick your the butt of your Q-tip up with your sterile hand, I can transfer it to this hand. And now I'm going to rinse with my water. And when I do it with this hand I can't use to manipulate, but I can have a little more freedom to move around in here because I'm not worried about contaminating this hand. Does that make sense? Okay. So that's the rinse. I come back to this with my sterile hand, and now I'm going to dry, and I'm going to choose to transfer this because I can dry a little bit better when I don't have to worry about contaminating this hand. So I've washed, rinsed, and dried. Now I'm going to take the inner cannula out of the trach, and I'm going to drop this into my hydrogen peroxide solution and kind of rinse it around a little bit. From this point on, I will handle that inner cannula only with this hand. As soon as I touch that inner cannula, this will become my most clean hand. It's no longer sterile, but it's now going to be my most clean hand. Every time I touch the inner cannula, I will use this hand, and every time I come back to the field, I will use my most clean hand. So now I am going to clean the inside of that cannula, and so I will transfer this now to this hand and pick up my trach with my most clean hand, and I'm going to wash this out. I've got paper, I've got pipe cleaners, and I also have some Q-tips left over here. And I'm going to put this back down in my hydrogen peroxide solution because I'd like to brush the inside of that too. So I pick this up at the end, transfer it to this hand, and I'm going to scrub, scrub, scrub. And these can really be scrubbed almost like new. Now I'll drop it into my rinse solution, and I can rinse it around a little bit. Still my most clean hand. I'm going to come back here, bud, transfer to this hand, and now I can rinse, rinse, rinse with this Q-tip. Rinse, rinse, rinse. And I'm going to put it back down in there. And now I'm going to dry, but I'm going to clean it one more time. And I just contaminated. Do you see what I did? I reached into here with this hand rather than this hand. So we are going to spread some magic sterile dust over this and come back with this hand to pick up this pipe cleaner, transfer it to this hand, pick this up with my most clean hand, and rinse and rinse, rinse, drop, and now I'm going to lay this right down onto my sterile 4x4, or clean, most clean now, and I'm going to dry this with this hand. And I could dry it with the Q-tip also, but a little bit of moisture down that trach is not going to hurt, and I know it's water now. And then I will put this back into the trach, the inner cannula, until it snaps. I'm done with my sterile part of my procedure now, but I'll leave my gloves on, of course, through this whole procedure. And I now will, if she at any point in time is having difficulty with breathing, I'll stop my procedure, return the oxygen, and wait until she recovers. So I will put my gauze back on here. And then I'm going to put my new tie on because I want to change that tie. I will not take the old tie off until I have the new one on because this can be so easily coughed out. So I kind of have pushed those ties down to the bottom. There's not one way to do this. I'll show you how we're recommending now. This goes through here. And if you have Q-tips left on your field, you can use a Q-tip to help you push this through. A trick of the trade. These both come around the back of the neck, and you just want to be sure that they do not get caught on anything. This one will come through here. when you tie this, if you know how to do a square knot, do a square knot. If not, a granny knot. And if you're not sure what either of those are, just check your tie when you're done to be sure that it's not a slip knot and that it will slip. And you want 1 to 2 fingers that will go right in here. No more loose than that, and of course you don't want it real tight. Now I'm going to, I don't need the ends to be quite that big. So I'm going to trim those, and then I'm going to cut off the tie that I'm replacing. Then I am going to clean my area, make Miss Nightingale comfortable, ask her if she needs anything, follow through with my standard steps, and that would be the oxygen, definitely would be put back on again. Thank you, Missy. And that would be the end.